Hello, my name is Dr. Bruce Eimer, and I'm a Pennsylvania licensed psychologist. I'm an NRA certified law enforcement firearm instructor, and I'm also a Pennsylvania Act 235 certified agent. I perform the required Act 235 psychological examinations as part of a one-stop shop that we offer at my offices on selected Saturdays at 8 a.m. in the morning. For your convenience, we offer the psychological examination at that time, the physical exam conducted by a Pennsylvania licensed physician, and if you need to have your fingerprints done, we also have an approved Cogent fingerprinter at our offices available to help you. The purpose of this brief video is to give you the details about the psychological examination process so that your expectations are realistic. The purpose of the psychological examination for application into the Lethal Weapons Certification Program is to determine your psychological fitness to handle a lethal weapon safely and appropriately. Now, this is not limited to this only. The evaluation also looks at indicators of your psychological stability so that we can learn if you are going to be able to pick up the skills and the knowledge necessary in order to be a security officer and to carry out the duties of a security officer in a safe and appropriate manner. We look at indicators that will tell us whether or not you'll be able to handle a firearm safely, exercise good judgment and good impulse control, appropriate restraint, and also we look at your ability to communicate assertively as opposed to aggressively, your ability to get along with others, your acceptance of authority, and your ability to take orders and issue orders as is required. That is, as required by a security officer doing his or her job. And we're also interested in knowing, as stipulated on the State Police website and in the Act, that's Act 235, we need to know whether or not you have the ability to handle the high stress that sometimes and often can occur as part of the job as a security officer in dealing with difficult people and difficult situations, as well as combative situations. When you are evaluated by myself with the assistance of my staff who are not psychologists, it is necessary, and I look for, a positive attitude, appropriate interpersonal skills, the ability to communicate clearly and not aggressively, the ability to follow instructions and directions and pay attention appropriately, and also you need to demonstrate that you can maintain appropriate calm. Of course, you are administered as part of the psychological exam in my offices the required MMPI-2 test. And that test is administered to you in a group setting. You'll be monitored. You take the test on paper and pencil, and then your questionnaires, when you're completed with the test, are then scored on the computer by my assistants. You'll also need to demonstrate in your one-on-one clinical interview with me that your mental status is normal, and this will also be observed in terms of how you interact with others in the group that you'll be taking the MMPI test with. When I say mental status normal, what I mean by that is that you are not depressed or unusually anxious, angry, hostile, alienated, or paranoid, and that your expectations of yourself and of others are realistic. Now, there's some very important points that I have to highlight for you right now, so please pay close attention. I don't want you to have any misconceptions about what the psychological exam entails or how it is conducted by me. In the past, there have been some misconceptions that have gone around about how we do the psychological examination for the Act 235 program, and for that matter, misconceptions about how other psychologists perform the exam as well. I can only speak for myself. First of all, you can't rehearse or prepare for the psychological exam. You need to be yourself. You need to answer all of the psychologist's questions, which when you come to our offices, that would be me. You need to answer those questions honestly. You need to treat others with whom you interact and who you meet at the exam session courteously. And you also need to be able to read and understand the written items on the written questionnaire, which is the MMPI-2 test, and you need to be honest, totally honest in your answers to those questions. So you shouldn't overthink the questions on the MMPI, and you certainly should not copy anybody else's answers, or you will definitely fail. All of the answers must be your own and entirely your own. The MMPI-2 test is a test of psychiatric status and stability. It's an assessment of personality and of the presence or absence of psychiatric issues or disorders. You have to be honest in your responses. They're not right or wrong answers, they're true-false answers. So there are 567 items on the test, and you have to read each item and decide if that item is true or false for you. The items are given in the form of statements. You need to understand those statements when you read them in order to respond appropriately to them, and at the same time, you need to be able to pay attention so that you don't lose your place when you put your answers on the answer sheet as you're reading the questions, or the items that is in the question booklet. If you lose your place, you'll mess up your answer sheet, and then the scores that come out from the computer will look crazy, and you'll have failed the MMPI test. So that's also part of the exam, to be able to pace yourself and to pay sustained attention. If you lie on the MMPI, you'll fail it. You'll be caught. If you lie to me in your clinical interview, your one-on-one interview with me, you'll also be caught. I'll pick that up and you won't pass. So I can't tell you how to pass the exam, but I can tell you that by being honest and being yourself and being appropriate, that is your best bet of passing. Now, it's very important for me to point out that when you pay for taking the psychological examination with me, that doesn't guarantee that you're going to pass the psychological exam. Paying for the psychological exam is not a rubber stamp. Paying for the psychological exam is paying for a service which we offer, just like paying the physician for the physical examination, and if you choose, paying for your fingerprints. All I can tell you is it is very important for you to be yourself, to not compare yourself to others, to not think that you should copy other people's answers, because then you will certainly fail the test. And as long as you do your own personal best and present yourself in an honest light, that gives you the best chance of passing the psychological exam as I conduct it. The fact is that not everyone is cut out to be in the field of security. The job requires a special combination of mental stability and toughness frustration tolerance, respect for authority, emotional and mental maturity, common sense and street sense, courage, good judgment, restraint, and good comprehension. Now, if you don't pass the MMPI written test because of language barriers, poor reading comprehension, or literacy issues, or because you have attention deficit disorder, or difficulty sustaining your attention as a result of that or something else, then you're going to have trouble following directions and pacing yourself and taking that test, the MMPI. And you're probably not going to pass the MMPI test. Now, you have to pass the MMPI test and the clinical interview, and passing you or failing you is done at the psychologist's discretion based on the psychologist's clinical judgment. I don't take into account just one source of data to determine whether or not to pass or fail anyone. However, there are certain incontrovertible results that reveal that you will fail, and there are things I have latitude on, and there are things I don't. So I follow my own clinical and professional discretion in deciding whether or not to pass or to fail you or anybody else who takes the Act 235 Lethal Weapons Certification Psychological Exam with me. Now, there are two courses of action sometimes available if you fail the MMPI written test due to a language barrier or literacy issues. Okay, number one is that you fail, and I send in a failing score, a failing form to the state. You'll be asked to sign a release form that you give your permission for us to mail to the state police the results of your psychological exam, whether or not you pass or fail, and you'll be doing this at the outset of the exam session before you're examined. Now, in selected cases, given my own discretion, I might, in order to obtain further information from an examinee like yourself, if I need to, if it's appropriate, and this is in line with the Act 235 Lethal Weapons Training Act statute, I might tell you that you failed the MMPI test, and if you failed because of comprehension issues or language barriers, I might tell you that you need to have other tests administered for me to evaluate all of the above factors that I mentioned in terms of your mental stability and appropriateness for being an armed security officer. In that case, if you want to have a chance at passing the psychological exam, you'll have to agree to pay the psychologist for the additional time involved in administering additional tests to find out more about you. Now, in such an instance, the additional tests would not be administered on the same day when the group is convened for the group examination. Now remember, in the group examination, you're taking the MMPI paper and pencil test in the classroom as part of a group. You're being observed interacting with other people. That's part of the data that we collect. You're also given the opportunity to make friends and to network, which is a good thing. However, you're interviewed on a one-on-one basis by the psychologist, which is myself. If I offer, because you failed the MMPI, to administer additional tests, it'll be at your cost at my reduced hourly fee of $150 an hour. That's for the time involved. Additionally, it will be done on a separate day, a separate individual appointment. Now, just so you know, after your MMPI 2 is scored on the computer, and I've put together all of the information that you've provided and that I've gathered, I'll complete the psychological report on the state-provided report form. I do it on the computer because my handwriting is a doctor's handwriting and it's not very legible. I print it out, you sign it, and then I mail that form in to the state police within a few days. You won't hear from me after the exam session if you pass. However, I will give you a call and tell you you failed if that is the case and explain to you why. Other than that, there's nothing more that I have to say right now other than I have been doing this for a long time, really since the late 80s. The Act 235 was actually passed in 1979. I am a firearms instructor, both for civilians and law enforcement. I've gone through the program myself. I am an Act 235 certified agent, which I might have mentioned earlier. I'm familiar with firearms. Firearm safety is really important. And I have a very keen interest in making sure that people that have mental health issues that would preclude their being safe in the handling of firearms not be given access to firearms. While on the other hand, I, at the same time, I do believe that I have a very strong commitment to people's right to keep and bear arms. That's on the civilian side, obviously. You must understand that the Act 235 license card is not a card for concealed carry. That would be a Pennsylvania license to carry firearms. It doesn't require any training. It just requires that you're not a convicted felon or child rapist or wife batterer, that you don't have a protection from abuse order standing against you and things like that. However, and that you're a good character, of course. But the license to carry firearms in Pennsylvania for personal defense is separate from the Act 235, which is the license to carry a firearm as part of your job, whether you're a security officer, private investigator, bail bondsman, bounty hunter, bodyguard, and so forth. Okay? So it really makes sense that if you're getting your Act 235, that you also have your personal self-defense carry license also, because it's not legal to carry a firearm concealed just with your Act 235 card when you're not working, and at the same time when you are working and you're carrying a gun and you need the gun as part of your duty, then it's not legal to rely on your license to carry firearms for self-defense. So you really need both. Okay? All right. Well, thank you for listening, and good luck.